What if I told you that surviving a major injury is only the beginning of the fight? Hey everyone, Reece here from Nurse. Today we're diving into a critical concept for anyone in the medical field, the lethal diamond. It explains why some trauma patients, despite all of our best efforts, decline rapidly. It's a vicious, interconnected series of 4 problems that can turn a patient who seems stable into one in critical danger. Let's break it down. It's not just one problem, it's a destructive feedback loop of 4 critical issues: hypothermia, acidosis, coagulopathy, and hypocalcemia. So imagine a patient who's just been in a serious accident. They're bleeding, their body's in shock, and a dangerous chain reaction is already starting. A patient with a significant injury and blood loss will get really cold. It's a natural response, but a dangerous one. When the patient's body core temperature drops, the enzymes within, which are responsible for almost every chemical reaction in your body, begin to work less effectively. Think of it like a computer's processor overheating. It slows everything down. Our first and most critical step is to warm the patient up. This isn't about comfort, it's about reactivating those vital enzymes we talked about. We use warm blankets, forced air warming devices like a bear hugger, warmed IV fluids, and in severe cases, even body cavity lavage with warm saline. Hopefully you don't have to do that. The goal is to get their core temperature back up as quickly and safely as possible. When those enzymes slow down, so does your body's ability to clot blood. We need our clotting factors to work efficiently to stop bleeding, but when they get cold, they basically go on strike. This means the patient keeps bleeding, which makes them colder, which makes them bleed more. This is the vicious cycle starting. To fight bleeding, we have to replenish what the patient is losing. We give blood products like red blood cells to carry oxygen, fresh frozen plasma to replace clotting factors, and platelets to help form clots. We might also use medications like TXA to help stabilize the clots that are forming. The key is giving the right products to the right ratio to halt that bleeding and stop the cycle. As the body goes into shock and doesn't get enough oxygen, it switches to a less efficient form of energy production, but the cycle creates lactic acid as a byproduct. This makes the blood more acidic. This acidosis not only makes the hypothermia and coagulopathy worse, it also makes the heart muscle weaker and less able to pump effectively. The best way to treat acidosis in a trauma patient is to fix the underlying problem: inadequate tissue perfusion. This means stopping the bleeding and restoring blood flow and oxygen to the cells. As we successfully stop the bleeding and support the patient's blood pressure, the body naturally clears this lactic acid. In some cases, we might use sodium bicarb as a bridge, but the definitive treatment is always to address the source of shock. In a trauma setting, we're giving patients a lot of blood products. Most of the blood products contain citrate, which actually binds to the calcium, leading to lower calcium levels. The calcium is absolutely crucial for both blood clotting and for heart and muscle function. So, as we transfuse, we can inadvertently lower their calcium levels, which further impairs clotting and cardiac function, worsening this entire cycle. This one is simple, but super critical. We give calcium. In the past, we didn't always think about this, but now correcting calcium levels is a standard part of mass transfusion protocol. We give calcium chloride or calcium gluconate to directly replace the lost potassium, ensuring that the clotting and cardiac function can proceed normally. As you can see, each of these 4 links, hypothermia, acidosis, coagulopathy, hypocalcemia, don't exist in a vacuum. They feed into each other, creating this cycle that can be incredibly difficult to break. Our job as medical professionals is to anticipate this and aggressively break the cycle with interventions along the way. We must warm them up, correct their pH, replace their clotting factors, and now more than ever, be mindful of their calcium levels. Thank you very much. Like and subscribe if you have any comments. Please leave them down below. Y'all have a good day.